Hey everyone, and yeah, thank you very much for making the time to come to this open event for the BSc Occupational Therapy program. I'll just start off with some introductions. My name's Sarah. I'm one of the lecturers on the OT program, and I'm also the admissions tutor for occupational therapy. And then I'll actually hand over to our OT student who's on the call too.
Hi everyone. It's lovely to be here with you. My name is Lizzie and I'm a third year on the occupational therapy course here at the moment. So I'll be here to tell you a bit about my experience and then help answer any of your questions afterwards as well.
Thank you, Lizzie. So I'm just going to do a short presentation about the OT program, and then I'll hand over to Lizzie to talk a little bit about her experience as one of the students here on the program. And then we'll make sure that we've got a lot of time for questions afterwards. So if you think of any questions as we are talking, if you want to just pop those in the chat, and we'll come back to answer those. So don't feel you've got to wait until the end. If you think of a question, if you could just put it in the chat, and we'll come back to work through any questions that there are at the end. Okay, so what I'm going to talk about is I'm going to talk just a little bit about occupational therapy as a career, because you might be still kind of trying to decide whether occupational therapy is the right sort of program and career for you. So I'll talk a little bit about that. Then I will talk about the occupational therapy program at City St. George's, the BSc. And then I'll talk a little bit about admissions, so like the entry requirements for the program. So if you think about how you would answer this question. So occupational therapy really is a career that's very much centered on people. It's about helping and enabling people. So if you think, are you a creative problem solver who enjoys helping people to get the most out of life? So, if you feel that you are, then I suppose those are some of the sort of things involved in being an occupational therapist. So it might be, a career that might be a very rewarding career for you to consider. So just to talk a little bit about what we mean by occupations, because I think people often think about work when we think about occupations. But within occupational therapy, occupation means something much broader than just work. It is kind of all the everyday activities that people do to give meaning and purpose and structure to their lives. So that might be things like self-care activities, so like getting dressed, eating, those kind of things we do to look after ourselves. It might be work, so that might be like paid work, or for children, it might be kind of schoolwork, and leisure, which is the things we do for enjoyment. So all those things are occupations. So all those daily activities that people need, want, or like to do. So occupational therapy helps people to do those daily things or daily activities that we call occupations that are important. So it's a science-based and a health and social care profession. So occupational therapy really does take a whole person approach. It's very much looking at both the mental and physical health and well-being that enables people to achieve their full potential. So what is occupational therapy? It's a very person-centered health profession that is about promoting health and well-being through occupation. So it's the only health profession that uses occupation to enable people to improve people's health and well-being and quality of life. So it enables people to participate in the activities of everyday life that are most important to them. And to do that, you might work with people individually or kind of with groups and communities of people. So this little quote here just really captures, I think, a lot about occupational therapy, where it says occupational therapy practitioners ask what matters to you, not what's the matter with you. So it's very much about what's important to the people that we're working with. And it is kind of quite I suppose, strengths based rather than being only focused on people's sort of underlying impairments or deficits. So it's a career for everyone. So there are such a range of people um, who will need support from occupational therapists. And so as a profession, we really committed to attracting people from all walks of life to the profession. The people who need support from OTs are very diverse, and we want OTs to also be really diverse to be able to meet the needs of the people that we work with. So when might someone need an occupational therapist? But that's when there are problems with their everyday occupation, so their everyday activities. And that might be because of a whole range of reasons. It might be because the person has an illness or a disability that impacts on them doing their daily activities, whether that's like a physical disability, like maybe somebody's had a stroke or been in a car accident or has arthritis, any of those types of physical disabilities. Or it might be because of a mental health condition, so something like depression or schizophrenia that that impact on people being able to do those daily activities that are important to them, whether that's kind of self-care activities or work or leisure activities. It might be because of getting older, so like aging. Or it might be because of the environment, just the opportunities that are available in the environment or change in personal circumstances. So, where do occupational therapists work? Occupational therapists work in a very wide range of different settings, which I think is one of the sort of really nice things about occupational therapy is that when you finish the degree, you'd be qualified to work in any of these settings. So, people often think of hospitals, and OTs do work in hospitals, but it's a lot broader than that. So it might be, you can see that might be like working in prisons, care homes, homeless services, GP surgeries, housing departments, in schools and nurseries with children, in mental health settings, which might be in the community, like going into people's homes, or in hospital settings, refugee communities, in private practices, social care settings, um, and, you know, sort of role emerging areas of practice as well, like working with disaster survivors um, and refugees. So it's a really broad range of settings that you would be able to work in as an occupational therapist. So, what do occupational therapists do? So, occupational therapists can work with people from very wide-ranging backgrounds and people of all ages. So, right from there'll be occupational therapists who specialize in working with really young babies, like in neonatal units and young children, all the way through to kind of end-of-life care. So it's very diverse, the people who you would work with locally, nationally, and internationally. So the skills that you need as an occupational therapist, I think, you really need an interest in people. It really is about, it's one of the professions that's really about working with people to improve their health and well-being, compassion and a desire to help other people. Communication skills are really important because you're going to be working with people, whether you're working kind of within teams of professionals, and also to work kind of directly with the patients and service users in practice. You need curiosity and an open mind and problem solving skills because that's really involved in enabling people to do what's important to them, kind of overcoming whatever is a barrier to them being able to do those activities that kind of matter most to them. So why become an occupational therapist? These are just some of the points. Well, you can help people to do those activities that matter most to them to really improve their independence and quality of life. It's the only profession that uses occupation as a therapeutic tool. You qualify to work in such a broad range of settings once you have got your degree. And you really do have excellent career prospects as an OT. There is a national shortage of OTs, so there are a lot of posts that are available, and our graduates very often have work before they've even qualified, or very shortly after being qualified. So you just have to look on the NHS jobs website to see how your career prospects are really good as an OT or excellent as an OT. So why City St George's specifically? Because you could study occupational therapy at various different universities. So some things about City St George's. You may have seen on the website, St George's is the UK Specialist Health University, in that at St George's, all of the courses are health courses. So everybody who's studying at St George's has chosen to do a health course, whether that's studying medicine or physiotherapy or radiography. Um, so I suppose in that sense, people are like-minded in that they have chosen a career that's ultimately about helping people. The campus is on the site of a large teaching hospital. So I'm sitting here now actually looking out the window at the helipad where the helicopter comes for sort of bringing emergency cases to the hospital. And I think you really get a sense of being in a hospital environment when you are walking around here. Hopefully, you'll be able to come on a campus tour at some point. To kind of get a sense of that. But you might be, standing at a coffee shop downstairs next to a patient or a doctor. It is, and we also have close links with the occupational therapy department in the hospital. Um, so I think that's different to a lot of settings where you are actually, I suppose, in um, in the same building really as the hospital. It's on the hospital site. A high proportion of our students graduate with good degrees. So we've had a high proportion of students graduating with first class degrees or 2-1s. And the data you can see on the website from our BSc is that 100% of our graduates are in work or further study within 15 months of completing the course, which is really excellent. And as I said, many third years will have jobs before they have even graduated. The NSS, this I think you may have heard of the NSS. It's the National Student Survey, which is just a survey that the students complete, which gives a score about their satisfaction with the program. And we've had consistently high NSS scores, showing that the students have a high level of satisfaction with the program. Some other reasons for studying at St George's, we have a smaller student cohort. So I suppose that's nice in the sense that I think the students can get to know each other quite well because you work together closely in teaching sessions, but also I think the teaching staff can get to know the students kind of individually in a way that might be more difficult with larger cohorts. I think we see the diversity of the students as a real strength. I think you just really need to walk around St George's to get a sense of how diverse the students are. So we have students from a whole range of different kind of backgrounds, ages. We have students who are have caring responsibilities. We have an increasing number of male students, which is great. So I think we see that diversity as a real strength. The the course team are will be taught by occupational therapy lecturers, but also lecturers from other programs. So maybe like physiotherapy or radiography, physiotherapy or healthcare science for some of the interdisciplinary modules. But the occupational therapy course team are all of the lecturers have worked as occupational therapists in practice. We all have kind of different experience, different backgrounds. So some of us have worked in mental health, others in with children or strokes. So a real sort of range of backgrounds. And many of the lecturers are sort of actively involved in research as well. The teaching spaces, so we have what we call the Art of Living suite, which is a room that's sometimes used for kind of occupational therapy practical sessions where we have some equipment or assistive devices, wheelchairs, that sort of thing. And there's part of it that's set up like an adapted kitchen. There's some sort of adapted bathroom equipment so that you can kind of practice the skills that you'll need before you go out on placement in kind of with lecturers or tutors there. There is a really great library which has study spaces and computer rooms and a lot of kind of journals. And sorry, I'm just trying to move something that's blocking my screen, which is a bit annoying. So I can see what's on the slide. I think I might have done it. Um, yeah, and a lot of the sort of texts that you'll need for your modules are available electronically as well. So you can access a lot of the sort of textbooks and journals as ebooks and e-journals online. And there's also a dissection room and a pathology museum that you will access in the first year when you do a module that has quite a lot of anatomy in it. Okay, so the program is accredited through the Health and Care Professions Council, that's the HCPC, the Royal College of Occupational Therapy, which is the RCOT, that's the professional body, and the World Federation of OT. And you qualify to practice when you finish the degree, which is a 3-year program. You will go out on placement on each year of the program. So there are 1,000 hours of practice placement experience that are included in the program. That's just a photo of some of the students during, I suppose, quite a sort of typical occupational therapy teaching session. So it kind of gives you a sense on how there's quite a lot of learning through doing, kind of learning through discussion. And that's in one of the rooms that's quite often used for OT teaching sessions. So it's a 3-year full-time BSc program, which has 3 terms in it of about 9 to 12 weeks. There are about 16 to 20 hours of teaching per week, plus your own study time. And you'll be taught in lectures. So there will be some lectures where, I suppose the lectures that you would think about where, the lecturer will talk on particular topics. There's quite a lot of kind of small group work and kind of seminars. And we have we use a virtual learning environment called Canvas is the one we're using at the moment, which is the kind of the virtual how you access all of your PowerPoint slides and materials that you need for teaching sessions. And we also record all of the teaching sessions on there, so you can watch teaching sessions back afterwards if you want to. As I've already said, there are 1,000 hours of placement in the program throughout the 3 years. Okay, so these are the modules in the program, just to give you a bit of an idea of what they are. So this is in year 1, and you can see that the modules that are in dark green are the interdisciplinary modules. So those are the modules that you will do with students from other programs. And then the ones in light green are the occupational therapy modules, and the blue one is the placement that you'll do. So you can see there are two interdisciplinary modules. Essentials for Allied Health Professionals is a big module that you do in the first term of your first year. And you do that with students from other programs like physiotherapy and healthcare science. It's a big module, and you cover a lot of like anatomy. And I suppose the name gives you a big clue about what it's about. It's about things that you would need to know um, for any of becoming any of those health professionals. Um, so that uses up quite a lot of of your time in the first term of first year. Then you also, in the first and second term of your first year, will do a module called Theory and Practice of Occupational Therapy 1, which is a lot about kind of the core theory and foundations of OT. Um, you also do another interdisciplinary module with physiotherapy students called Factors Influencing Professional Practice. And then there you will do a research module in each year of the program. So the first one in your first year is called Understanding and Reviewing the Evidence Base. So and then you will build on what you've learned in that in the second and third year. And you'll go on one practice placement in your first year, which is 4 weeks long, and it's right at the end of the first year. Then year 2, these are the modules that you do. These are just done as occupational therapy students. So these ones aren't interdisciplinary like you did in the first year. So there's theory and practice of occupational therapy 2, human occupation across the lifespan, and occupations in context, which really are all about occupational therapy intervention. So enabling people from kind of very in diverse settings and with diverse needs to participate in their daily occupations as best to reach their potential with that, I suppose. Um, and then you do a module in the second year called Analyzing the Evidence Base, which is where you learn a lot about kind of the research methods that you will need to go on to do a research project that you will do in the final year, which is you will conduct a research project in your final year. And then you do one practice placement that's 8 weeks long in the second year. And then in third year, those are the modules that you do. So I think that the names give you a good big clue about what it's about. So one is about reflection and leadership in for occupational therapy. You do a module called Advancing Occupational Therapy Practice. And then the research module in the third year is called Contributing to the Evidence Base. So that is a module where you will do a research project. So you will be supervised by one of the lecturers in the OT course team for that. And it's you can really choose a topic that motivates you and interests you for that. And then you do two practice placements, which are 8 weeks each in the third year. So just a little bit about the entry requirements. So, and you can find all of this on the website. It's a UCAS application for the program. All of the academic entry requirements are on the City St George's website for the BSc Occupational Therapy program. So for GCSEs or the equivalent, you would need to have maths, English, and science at grade 4. That's a C or above. A levels or the equivalent is BBB, and then you can look on there for all the equivalents to that. on the website, whether that's sort of a B Tech or IB, and various different qualifications. You also you will need to write a personal statement as part of your application, and we also interview everybody whose application is shortlisted for interview or successful. So we're looking for a commitment to study occupational therapy. So you need to show that you know what it is and that you're motivated to study occupational therapy, and that you have some understanding of the scope of practice. Then the interviews that we do are called MMIs. So those are multiple mini interviews. And those are really about, they really are centered around the kind of core NHS and social care values. So we're not looking for a lot of knowledge about occupational therapy. You do need to know something about what it is and why you are motivated to become an occupational therapist. But the questions are really kind of scenarios or questions around those kind of core values. And then, because you are going to be working with the public and working with kind of vulnerable people, everybody needs to have a police and health check. So that's a DBS and to be cleared by occupational health is fit to study and practice. So I'm going to stop there because I want to make sure that there is time for questions at the end. But just before I hand over to Lizzie, just to say that those are some contact details. So please do. I'm Sarah, the second one down, admissions tutor, and I'm also one of the lecturers. As I said, you're very welcome to get in touch with me, or I've also got there the contact details for Rachel, who's the course director, and Caitlin is also an admissions tutor. So please, if you do have any questions or want to have a chat about anything, if you're thinking of applying or after you've applied, please feel free to contact us anytime. So thank you very much for taking the time to listen to this, and I am going to hand over to Lizzie now, if that's okay.
Hi everyone again. If anyone's recently joined, it's nice to meet you. I'm Lizzie and I'm a third year occupational therapy student here at City St George's. So I'm just sharing a bit about my student experience here. And I've tried to think of what some of the key questions that I might have asked when I was considering studying occupational therapy at City St George's. So I'll try and include some of the answers to them. And then if you have any more questions, please do feel free to put them through in the chat, and Sarah and I can go through them later and respond. But question number one is why I chose occupational therapy. So I came to the course as a mature student. I had done a psychology degree previously, really enjoyed it, but wasn't sure what to do with it afterwards. So ended up getting a job as an administrator and was there for 6 years. And then realised that I didn't quite know what I wanted to do longer term. And actually, before applying, I didn't really know what occupational therapy was until about a year or so before. I think what made me consider it is I've always known that I love helping and encouraging people, but sort of started considering healthcare professions a bit more closely after watching a video on social media of a 17-year-old girl who was paralyzed in a cheerleading accident. And her life just changed so dramatically after that accident. She was once so independent and doing all the things she loved, and then in a fairly quick instant, that all changed, and she was dependent on others for support. And in her social media, she sort of documented how she learned new ways of doing activities that she enjoyed from I say small things, but what would have felt probably very big and meaningful to her. But working out how she can apply her makeup, even though she's not got full use of her hands and upper limbs, and just seeing how occupational therapists and healthcare professions can come alongside people to help, like Sarah was saying, overcome the barriers that are in place. So that was what made me really realize that occupational therapy was what I wanted to do. Um, and then why I chose City St George's, again, Sarah touched on this already, but I really loved that it's the Tooting campus is a specialist healthcare campus. Um, this made me really feel like they knew what they were doing, and they do. And it's allowed us to have shared lectures with other healthcare students, like Sarah mentioned, such as physios and radiographers. During various points in the degree. And that's really important, I think, as well, because you'll discover on placements, but also when you get a job afterwards, we work so closely with other healthcare professionals to try and provide the best care for every patient. And so it's really good to be practicing those skills of communication with other healthcare professionals right from the start of your degree. Um, and again, like Sarah said, there's just something about being in a hospital and you're kind of around the patients, you're around their family and friends, but you've also got students there. So you kind of feel like you're in amongst it um, already. So I would very much recommend. And then what would I say I enjoy about the course? Well, there's lots of things. I think one lovely thing is there are a range of ages, as Sarah mentioned. So as I said, I came to the course, I think I was 27 when I joined, and I was worried I might be the oldest, but that wasn't the case. But it was there are such a range of people on my course. So there's at least, I think, a third of us would consider ourselves mature students, as it were. So over 25, but then 2/3 were probably more like school leavers. So there's a whole range of ages. And also the cohort is like nice and small. So I know everyone by name, and you get to know the group of people and you spend that time with them over the 3 years. So that's been like a real bonus as well. Um, I would have to say one of my favorite things about the course is the placement element. So I'm actually currently on my third placement at the moment. I'm currently sat at St George's in the library, so you can have individual study pods. Should you ever need to take a Teams call like this. Um, but I would, yeah, really recommend the placement element. They're so varied. My first one was in a hospital on a respiratory ward for 4 weeks, and then my last one was in a long COVID clinic. And I'm currently based in a hospital again at the moment, in an acute stroke unit. But there are so many other areas you can be in. So there's lots of different places, like Sarah said, like mental health, so in the community, or acute psychiatric wards, and schools. And there's just such a wide range of placements. And I've really loved seeing how the theory applies in those different areas, and how occupational therapists function, um, and what that looks like for them working in those areas. And you just learn so much from them. So that's something that has really appealed to me. Um, and then I think as well, what I really liked about the course is the first year feels like you're very much setting the foundations. So you're learning about the theory of occupational therapy and sort of the basics of anatomy. And then second year really feels like you're sort of building on that. So you start thinking about occupations in context and sort of occupations across the lifespan. And I really enjoyed that, in particular, sort of thinking about how the theory applies in practice. Um, and yeah, the staff are really approachable as well, which makes a big difference. So if you've ever got any questions, they're always very happy to answer those questions. But also if you just want to chat with them about anything, they're also very open to that too. Another thing I thought people might ask is living on campus versus commute. So one of the benefits of being in London and in Tooting is that we do have really good transport links. So I personally commute. I was living in Southwest London anyway, so I commute for 45 minutes. And actually most of my year group at uni do the same. So they commute from wherever they are in London. So I think we've got at least a couple of people in Essex way, but also Hampstead and lots of different areas, or Southwest London like me. But we also do have a couple of people living in Horton Halls, which is the university accommodation for students on the Tooting Healthcare campus. And I've heard really good reviews about that as well. So whether you're planning to stay at home and come to St George's, or whether you want to sort of have a different university experience and sort of be on a campus accommodation, there's the option for both of those things. So yeah, so hopefully that will cater for whatever you would prefer. And I would just say as well about Tooting that it's just has such a buzz to it. There's so many, it's such a vibrant place, and there's a brilliant food market around the corner and so many shops that you can go into, which can be a bit dangerous, but it's good. And yeah, the transport links as well are really good. So you've got very easy access to like the Northern Line and everything. So yeah, so I would recommend Tooting as an area as well. And then in terms of sort of course schedule and workload, so Sarah touched on this already. It is a full-time course. I would say the most I've normally ever been in a week is 4 days a week, but more often 3. However, you are expected to do study on the other days, but you're not necessarily in every day, but there's sort of self-reflected studies to do ahead of the next lecture. And I would say about the course, one of the aspects I was a bit nervous about was doing the anatomy sort of module in first year, because it just takes me a little bit of time to learn biology and doesn't always come naturally to me. But what I would just recommend is that you just give yourself time, and you use the resources they give you. They've catered to lots of different people's learning preferences. So there's videos that you can watch, but there's also like written text. And then as Sarah said, there's a dissection room, so you can like physically sort of see what things look like in practice and kind of learn that way. So there's lots of different ways that they cater for different learning needs, and there's always people available as well to ask questions, which is really helpful. And then I would just say as well, like on balance, some people are worried about balancing like course and just general life. For me, what I would just recommend is, I guess, having come from a job before, I try to treat my degree as a 9 till 5 job during the week. So I try and commit 9 to 5 every day, regardless of whether I'm in lectures or whether I've got a study day at home, to doing degree related things. And then that gives me the weekends and the week evenings as well, to do other life and see other friends, and yeah, to do all that. So I think it's really important to try and strike a balance. Like, it's great to get really invested in your course, but it's important to keep doing the other things that you enjoy as well. Because that's just really important. And we're trying to encourage our patients to be doing the things that they're enjoying. And so I feel like we need to model that ourselves as well. And then I think my last thing to say would be, there's lots of different societies that you can get involved in at City St George's. The range of like cultural societies, as well as sports societies, or things like the musical society. I think they did Legally Blonde last year. We've also got like a really nice student bar on site as well, that you can use throughout the day just for like working or meeting up with friends. But then they also host like quizzes or society events and things in the evenings, which you can use. But yeah, I would just say that City St George's is a great place to be. I'd really recommend it, and hope that you might be considering to join too. But yeah, that's everything from me. I think we can see there's a few questions that have come in, but I'll hand over to Sarah first and see where we go from there.
Yeah, great. Thanks so much, Lizzie. We'll just work through. Sure, if we just, some of these, Lizzie, I think you might be better to answer than me, but I'll ask you when I think I've got one that's better for you than me. So I've just got one here from Mariam. So, are placements only at the end of each year? So no, they're not. It is in the first year. The first 4-week placement is at the end of the first year. but the rest of them are kind of integrated into the program. So not they're not only at the end of the year. It depends on the year of the program you're in. And do you attend lectures while on placement, or is it just the placement? So while you're on placement, you just do placement. So you'll either be doing modules. If you're doing the modules, you won't be on placement. And when you're on placement, that is all you do so that you can concentrate on the placement. The next question is, are all placements in London? The placements are in London, but also sort of the greater London area. So we do have like some placements, like for example, in Surrey or as far out as Essex are some of the placements. So yeah, but I'd say the majority of the placements are in London, but not, yeah, it's the London and sort of greater London area. Um, and we just started to introduce, there's the possibility of an international placement as well. We've had a very small number of students go on an international placement, which is a possibility. Um, but yeah, the majority of placements are in London. But yeah, if we know that you live, for example, in Surrey, you you may get a placement there, depending on the offers that we have available. And we've got another question here. Also, would you be able to show us a sample timetable to give us an idea? So your timetable will really, so once you start the program, you will get quite a detailed timetable. But just to give you an idea, so when you are on placement, as I said, you will just be on placement Monday to Friday, and you work the same hours as your practice educator. So that would be like 8 till 4 or 9 till 5 usually. Um, and then when you are doing your modules, um, you would generally be in on site about 3 days a week, but it can vary a bit depending on the modules that you're doing at the time. So just to give you an idea, like when you start the program in year one, you will really be doing two modules. So there's one module called Theory and Practice of Occupational Therapy that you will do every Monday from 10 till 3. So we try with the OT modules as much as we can to start sort of after the main school rush for people who have to drop children off at school, or just so that you're hopefully not in that crazy um, London traffic rush. So with the OT modules, we do tend to start those at 10, but you may have to start earlier as well, particularly for the interdisciplinary modules. Those often will have an earlier start time. So like in first year, in the first term, like for the students in first term now, every Monday they'll be in that OT module from 10 till 3. And then they do the other module, the one, I don't know if I mentioned that module, that's the big Essentials for Allied Health Professions module, the one that you do with students from other programs. And that one you will generally do about about 2 to 3 other days a week on that module, and then typically one day, like a Friday, usually would be kind of self-directed. So there would be sort of activities that are set for you to do from home. You can choose to do it in that time, or you if you have like a part-time job and need to be working or doing something else in that time, it's kind of flexible around when you decide to do the work. You might decide to do it late at night or on the weekend or whenever kind of suits you. But it does sort of vary. I think so like the second years, I've just been teaching the second years before I came here um, to this meeting. And for them, they are at the moment, they doing kind of two occupational therapy modules that are really focused on kind of intervention. And they do the one module they do every Monday and Wednesday morning, and the other one they do every Thursday, kind of from 10 till 3. So then the Friday would be kind of independent study for them. And Lizzie, do you want to just say what your module, as Lizzie's on place, you're on placement at the moment, aren't you? But do you want to just say what your third year's been like so far?
Yeah, so on placement at the moment, I was only back at uni for about 4 weeks before coming. So I'm trying to remember. Wait, we were in 3 days a week for those 4 weeks. I can't quite remember which days they were. I think it was like Monday, Wednesday, and Friday, I think. Um, and then so I'm on placement now until Christmas. And then in the new year, we've got, I think, teaching on Mondays and Tuesdays. And then I think we've got the rest of the week sort of as time set aside that we can work on our research project that we have to do as part of our third year. Um, and then in the summer term, we've got placement again. So it's slightly different in third year because you're spending a lot more time on placement, but it's still roughly 3 days a week when you're in uni. Yeah.
Lizzie? And then, so hopefully that gives you a bit of an idea of what the timetable would be like. Then we've got a question here. A do you need A level science? No, no, you don't. There's no subject requirement for level three. So it's only GCSEs that you need science. You don't need it for A level. Are there any entrants straight from school? Yes, certainly a lot. A lot of the students. So there are quite a lot on your. Well, I know you're in third year now, but did you find when you started in first year?
Yeah, I think like I said earlier, I think about a third of the students were those sort of over 25, but then about two-thirds of our course were school leavers. So yeah, so you won't feel alone, whatever age you come to the course. There's always going to be other people in a very similar position to you, and it's great to sort of see the mix between that. And I've just noticed the next question is what is student life like? Again, I hopefully answered a bit of this earlier, but I would say student life can look very different depending on what you enjoy and what you like, and whether you're living on campus or if you're commuting. But I would say that there's stuff that can cater for all your hobbies and enjoyments and things you can do. Much to do in tutoring. Like you can have lectures and then you can go and join some of your fellow students and go for like dinner or like grab lunch together. If you live on in halls, that will be a very different experience as well because you're sort of spending all your time with other students. Whereas others who are commuting like me, you might have other things that you're going back to. But then you get to sort of socialize with everyone when you're at uni. And again, like I say, there's lots of different societies. So I think another question later on is there a music society? I am almost sure there is. I can't 100% confirm that, but there is a music room. And I'm pretty sure that I have heard that there is a music society. But like I say, there's also like a musicals society. And one of my fellow members in the cohort, I think is the president of, I think it's like the Musical Society, and they did a 24-hour musical a couple of weeks back. So yeah, so there's lots of different things, and you can kind of make what you want of the student life as well. You can join in on as many things or as few things as you really want to, I guess. Um, yeah, and just looking at the one below actually, so do we cover every area of occupational therapy during placements? Sarah might have more to add. But they try to really give us a variety of placements where possible. So from my understanding, they try and give you an acute setting placement where possible. So you have at least one in a hospital or that kind of acute setting, at least one in the community, so you can kind of see the difference. And I can tell you that there is definitely a big difference in working in the hospital and community. So it's good to experience both of those, but also trying to make sure you've got perhaps one that's like more physical health focused, and perhaps one that's more mental health focused. But one thing I've really loved is, although mine placements so far seem to have had a bit more of a physical focus, mental health, you can't like detach it from physical health, I would say. So a lot, like for example, in the stroke unit I'm in now, if someone's gone through a stroke, it's probably going to have had some impact on their mental health because they've had a huge life change. So although I'm not necessarily on a mental health placement, I'm still being able to support that patient whilst they're going through different challenges, perhaps with their mental health. But yeah, you might be in schools, you might be, I think, like helping people with dementia or elderly care. So they really try and give you a variety, if that helps.
Yeah, thank you, Lizzie. And then the next question here is, do we have a choice of where to do placements or are they assigned? So your placements are assigned to you. You don't need to organize them yourself. As Lizzie's already said, we need to make sure that you have the experience that you need. So, like Lizzie said, within physical, mental health, community, and acute settings, within the offers that we have available from kind of the different providers. There are some placements where we do ask for your sort of preference so that you can indicate what you'd like to do so that the people allocating the placements are aware of what you'd like to do. Um, it's not guaranteed that you will definitely get that because we're having to, like we've just said, make sure that you've had the placement experiences that you need to be competent when you qualify, and also we working within the offers that we have available. But it is taken into consideration. We obviously do want to place you where you want. Sometimes people all want the same thing. Like there are some placements that tend to be very popular. Like quite often people want to go into a children's setting, and we've only got a certain number of offers from children's settings. So I suppose within those limits, we would try to take that into consideration. Um, do you want to answer the next question, Lizzie? It's about how is the course assessed? Do you want to just talk a little bit about kind of how the sort of assignments that you've had on the
Sure.
program?
Yeah, absolutely. Just quickly before that, I've seen that there are questions come in about placements. So I'll just quickly, or not, oh, don't mind me. That's not true. I got that confused. Yes, so how is the course assessed? So in a lot of it is coursework. So wonderfully, we only have one exam in the whole 3 years, and that is just for the anatomy module. So that might come as a real encouragement to many because not everyone loves exams and exam conditions. So there's just one and for anatomy, and it's a multiple choice one as well. And then the rest of it, yeah, I mean, it's a variety of assessments. So coursework, it might be presentations, individual presentations, or group presentations. You might be presenting about like a particular or writing an essay about a particular case study and how you might do an occupational therapy intervention with them, or you might be yeah, quite a few of them, like particularly in second year, you're sort of able to draw on your placement and think about a case study from there and sort of talk about that and factors that might have impacted what we would call their occupational performance, so their ability to engage in different occupations or activities. But yeah, there's a real range, so it's not just straight up essays. There's a real mixture. Might be doing posters, you might be doing presentations, you might be doing or what's the word, like an assessed almost meeting. So we've had some that are sort of like simulated meetings of what you would experience in practice, and they kind of they assess sort of how you interact in those meetings, how you kind of manage that, and what you're able to sort of bring to the table in those meetings. So yeah, there's no one type of assessment, I would say. Sarah, is there anything else you'd want to add to that?
No, I think, and I suppose I'm not sure if you said that. I was a little bit distracted looking through the how many questions we've still got to get through for the end. But you might have already said it. Apologies if you did. But did you also get assessed on practice placement?
Oh yeah, no, I didn't say that.
Yeah.
Yeah.
So that's a, I think that's quite you when you're on placement, the OT who's in the setting will be your supervisor, and they kind of use the assessment paperwork that we have from the university, and they get kind of training from the university to use that. So you kind of being assessed on a day-to-day basis in a real sort of real life practice setting. Um, And there is a link tutor in the university who'll be one of the lecturers who's kind of like the link to the placement for kind of giving support to you and your practice educator as needed. Um, I'm just looking at the next question, just making sure I don't miss any. So is there any support at the uni for mature students or those with caring responsibilities? I do think that St. George, yeah, City St. George's is particularly good with student support with people with kind of a range of needs. So there is so much support available through the uni. And a lot of your induction week, the first week of the courses will be an induction week. And a lot of that is really understanding how to access the right support for you. So I think it used to be called the Student Life Centre. I think they call the Student Hub now. They offer support with a whole range of things. And you will hear more about that in the induction week. So yeah, there is very varied support based on kind of the diversity and individualized needs of students. And there's a lot of support around sort of academics as well for people who maybe um, have had a bit of a gap from studies. So things like, helping you with essay writing and referencing, and if that's something you haven't kind of done too recently as well. So yeah, I think St. George's is pretty good on support. Then we've got a question. Do you have to choose a specific area of OT in your third year to specialize, or do you decide at the end of the course? So that's a really good question. You don't actually specialize at the end. So I think you qualify to practice in a whole range of settings, which would include some of the ones that we might call more specialist settings, like I don't know, like I'm trying to think what might be called a specialist setting. Like if you're working, for example, in hand therapy, where you're making hand splints, that might be seen as more specialist. Or if you're working in like a neonatal unit with, very young babies, or there are a whole range of different settings that might be called specialist, but you will really you qualified to work in any of those settings. So I think what would often happen is that people would apply for kind of band five posts after qualifying, which quite often will be rotational posts. So you'll get to work maybe in, depending on how the rotation works, maybe like 6 months in different areas of practice. So I'm just thinking like for me, I was really keen to work with children right from, I think I wanted to do that from before I even started the program, and I didn't really change my mind on the program. But it was quite hard for me to get straight into working in that area when I qualified. So I did about 5 rotations. I did like 6 months working on an orthopedic ward, and then I quickly realized that everybody wanted the children's rotation. So I applied for the sort of next post up. That was much more of a specialist post, working kind of with young children. So I think it really, yeah, the nice thing is that you're qualified to be able to work in any of those areas. And then it's through your kind of work experience, you might do sort of further training or courses in a specialist area that you're particularly interested in working, but you don't have to decide that or specialize at the end of the course. I think that is the end of the the end of the questions. So yeah, so thank you. I hope we haven't run. I don't think we have run over time because I think we did start slightly a little bit later. So yeah, so just thank you so much to all of you for kind of taking the time, whether you are watching this live in the session now, whether you're going to watch it as a recording afterwards. Thank you so much for taking the time to come to this, and thank you so much, Lizzie, for coming and sharing your experiences too. I always think students want to hear from or prospective students or applicants want to hear from the current students much more than they probably want to hear from a lecturer. So thank you very much for taking the time to come. And as I said, if you